This is what colon cancer looks like. And here is the terrifying truth. Right now, this could be developing inside your body completely silently, without you feeling a single thing. You see, unlike a flu where you get a fever within hours, or an injury where you feel pain immediately, colon cancer is a silent predator. It grows in the shadows. And today, I am going to walk you through 5 severe warning signs, 5 critical alerts that your body might give you. These are signals that you absolutely must take into account to catch this disease before it becomes untreatable. But I need you to stay with me until the very end of this video, because while knowing these 5 symptoms is vital, I'm going to give you the single most important piece of advice, a golden rule, that can actually prevent you from ever developing this destructive tumor in the first place. This represents the difference between a simple procedure and undergoing chemotherapy, major surgery, or potentially needing a colostomy bag for the rest of your life. Let's get into the reality of this disease. Colon cancer has many signs, but the most dangerous characteristic is its ability to remain hidden. Do not wait for these symptoms to appear to start caring about your health. By the time these signs manifest, the problem is already there. However, if you notice any of these 5 red flags, you need to seek a specialist immediately. Here are the 5 warning signs you can never ignore. Number 1, ribbon-like or pencil-thin stools. We call this narrow caliber stool. Imagine your intestine is a flexible tube like a garden hose. Now, imagine a tumor growing inside that tube. As the tumor gets bigger, it occupies space, narrowing the passage that the waste has to travel through. When your body tries to push waste past this obstruction, the stool is forced through a much tighter space. The result is that the stool comes out looking compressed, very thin, like a pencil, a flat ribbon, or a piece of tape. It loses its normal cylindrical shape. This mechanical change is a huge red flag. It indicates that something is physically blocking the lumen, the opening of your intestine. Now, it is important to take a breath here. Not every thin stool means you have a tumor. We have to look at your lifestyle first. If you are dehydrated, or if you eat a diet that is very low in fiber, your stool lacks bulk. It doesn't have the volume to expand the intestine, so it can come out thin. A great way to check this is to look at your hydration. There is a simple formula we use in medicine. Take your body weight in pounds and divide it by 2. That is roughly the number of ounces of water you should drink daily. Or, if you use the metric system, multiply your weight in kilograms by 35 ml. If you are drinking enough water, eating plenty of fiber, and your stool still looks like a pencil or a ribbon consistently, that is not normal. That is a mechanical issue, and it is a primary warning sign of a potential mass in the colon. The second severe signal is seeing mucus when you defecate. This is something patients often describe very specifically. They say, "I went to the bathroom and I saw something that looked like egg whites," or "it looked like white catarrh mixed in with the stool," or they notice a jelly-like substance on the toilet paper. Why does this happen? When a tumor grows in the intestinal wall, it irritates the lining. In response, or as a byproduct of the tumor itself, the intestine begins to secrete a thick, hyaline mucus. It's a defense mechanism, but it's also a sign of pathology. Now, just like with thin stools, we have to look at the context. Mucus doesn't automatically equal cancer. There are benign conditions that cause this. For example, large polyps, which are the precursors to cancer, can produce mucus. Inflammatory bowel diseases, such as ulcerative colitis or Crohn's disease, often present with mucus. Even severe food intolerances, like issues with gluten or lactose, can cause inflammation that leads to mucus production. Parasitic infections can do this too. However, in a healthy digestive system, you should not be seeing visible globs of mucus. If you are noticing this egg-white substance regularly, your body is telling you there is inflammation or a lesion that needs to be investigated. It is a sign of alert that requires your eyes to be wide open. This brings us to the third, and perhaps the most alarming sign, bleeding. Blood in the toilet bowl or on the toilet paper is never normal, ever. The rule of thumb in medicine is that all rectal bleeding must be investigated. Tumors are very vascular. They have a lot of blood vessels, and they are fragile. As stool passes by and rubs against the tumor, it can cause the surface to break and bleed. The appearance of the blood can actually tell us a lot about where the problem might be. If the blood is bright red, fresh, and vivid, it often suggests the issue is near the exit, in the rectum or the sigmoid colon, the lower parts of the intestine. If the blood is darker, maroon, or looks like clots or coffee grounds, it suggests the bleeding is happening higher up, perhaps on the right side of the colon. This gives the blood time to oxidize and be digested before it exits the body. Of course, we know that hemorrhoids and anal fissures are very common causes of bright red blood. If you have pain and tearing sensations, it might be a fissure. If you have visible piles, it might be hemorrhoids. But here is the fatal mistake people make. They assume. They say, "Oh, it's just my hemorrhoids acting up," and they ignore it for months. Meanwhile, a tumor could be bleeding intermittently behind those hemorrhoids. There are polyps that bleed. There are cancers that bleed. Do not self-diagnose rectal bleeding. If you see blood, you need a specialist to confirm exactly where it is coming from. Number 4 is persistent abdominal pain that does not improve. We all get stomach aches. We all get gas or indigestion from a bad meal. That resolves in a day or two. That is not what I am talking about. I am talking about a persistent, nagging discomfort. It could be cramping, a feeling of fullness, or a dull ache. It might be on the left side, the right side, around the belly button, or even high up near the stomach, the epigastrium. The key here is the duration and the resistance to treatment. If you have had abdominal pain for more than 90 days, that is 3 months, and you have tried changing your diet, you have tried standard over-the-counter medications, and it isn't going away, stop guessing. Many people go for ultrasounds or basic checkups, and nothing shows up. But remember, a tumor grows inside the hollow tube of the intestine. It doesn't always show up easily on basic scans until it is quite large. This pain often comes from the intestine cramping as it tries to push against a growing blockage. If you have unexplained abdominal pain that has lasted for months, you must consider the possibility of a lesion growing inside the colon. And finally, the 5th sign, and statistically, the most common symptom cited by medical professionals, alteration of bowel habits. This refers to a distinct long-term change in how your bathroom schedule works. Let's say you were always like clockwork. You went once a day, every morning. Suddenly, over the last few months, you are constipated. You go 3 days without a movement, and you have to strain. That is a change in habit. Or the reverse. You were always a bit constipated, going every other day, and suddenly you are having loose stools or diarrhea every single day. Any significant shift in your bowel pattern that lasts for more than 60 to 90 days is a major warning sign. We aren't talking about a weekend of bad digestion after a party. We are talking about a new normal that has taken over your life. While conditions like irritable bowel syndrome, IBS, or new dietary intolerances can cause this, a sudden change in an adult who has had stable habits for years is highly suspicious. It suggests that something in the physiology of the colon has changed, and a tumor is a prime suspect for disrupting that rhythm. So, let's summarize the 5 alerts. Mucus in the stool, pencil-thin or ribbon-like stools, rectal bleeding, persistent abdominal pain, a lasting change in bowel habits. But remember how I told you at the start that there is a way to stop this before it even starts? This is the golden tip that saves lives. The most dangerous thing about colon cancer is that it is often completely silent until it is advanced. By the time you have thin stools or pain, the tumor is already large. You want to catch it before that. There is an exam called a colonoscopy. It is the gold standard. This exam allows a doctor to look inside your entire colon, and here is the magic of it. Colon cancer almost always starts as a small growth called a polyp. A polyp is like a small wart on the inside of the intestine. It is not cancer yet. If you get a colonoscopy, the doctor doesn't just look for cancer. They find these polyps, and they remove them right there during the exam. By removing the polyp, you literally break the chain. You prevent the cancer from ever developing. You don't just detect it early, you stop it from existing. The current medical guidelines are clear. Everyone, regardless of symptoms, should start screening at age 45. If you have a family history, a parent or sibling who had colon cancer, You need to start even earlier, usually at age 40 or 10 years before the age your relative was diagnosed. And if you have any of the 5 symptoms I just listed, age does not matter. You could be 30, you could be 60. If you have bleeding, pain, or thin stools, you need to see a gastroenterologist or a colorectal specialist immediately. This is a preventable disease. It is a treatable disease if caught early. Do not fear the exam. Fear the silence of the disease. If you found this information valuable, please share this with your family and friends. You might save a life just by hitting that share button. Stay healthy, stay vigilant, and don't ignore what your body is trying to tell you.